Hi, my name is Dr. Tiffany Zigras, and I am here to share some important updates as we move towards primary HPV testing in March 2025. Today's video, we're going to cover some special populations that you might encounter in cervical screening. The first population that I wanted to talk about are those living with immunocompromise. Immunocompromised people might be at higher risk of getting precancerous lesions on the cervix or cervical cancer because they have a decreased ability to clear HPV infections. It's for that reason that the Ontario Cervical Screening Program recommends that we screen immunocompromised individuals every 3 years instead of the typical every 5 years for those who do not have immunocompromise. People who qualify as immunocompromised include the following: individuals living with HIV regardless of their CD4 cell counts, individuals who've had a solid organ transplant, those with congenital or primary immunodeficiency, people who are on immunosuppression medications for over 3 years, people who have lupus regardless of whether or not they're on any medications, and those who are living with renal failure and require dialysis. The age to start screening remains 25 years old in this population, even though they're immunocompromised. You might also be wondering if the Ontario Cervical Screening Program has screening recommendations that are different for two-spirit, transmasculine, or non-binary people with a cervix. In fact, the cervical screening recommendations remain the same in this population. Those individuals with a cervix who meet eligibility criteria and are due should be offered cervical screening. Remember that anyone with a cervix who's over 25 years old and is sexually active is eligible for cervical screening. Also remember that sexual activity is defined as any sexual contact with another person. This can also be a person of the same sex, and the contact can include hand contact, contact with the genitals or mouth, and can also include sharing of sex toys. Stay tuned for more updates as we approach March 2025, and if you have any questions, please feel free to reach out to me. We're very excited to embark on this journey with you.